Members of Parliament, ladies and gentlemen, welcome back to this Central Committee meeting of Parliament. This is Central Committee meeting number 6, and we continue with this meeting today, Wednesday, October the 16th. This meeting started out on the draft amended 2024 budget, at which time the Minister of Finance made a presentation that was then followed by questions from the members of Parliament. And since then, ministers have been coming and returning to respond to questions by members of Parliament. This afternoon, therefore, we continue with the Minister of VSA, Public Health, Social Development and Labour, Mrs. Janssen, who along with her support staff will be responding to questions that regard the Ministry of VSA. So at this time, a special welcome goes out to Minister Veronica Janssen and her support staff here this afternoon. And I immediately turn the floor over to the Minister in order to respond to the questions by members of Parliament. Minister Janssen, you have the floor.
Good afternoon, Madam Chair, members of Parliament, griffier, and the listening audience. I start today with the answers to the questions from MP Doran. Regarding the Aftercare Center, the HAP, the MP asked if he was to understand that the discussion is ongoing to continue with the HAP or to look for a different alternative, and what is the thinking of the government with respect to that. The answer, yes, this is correct. As previously stated in the earlier meeting, the need for a HAP is recognized, and internal discussions are currently ongoing regarding solutions that will lead to a HAP that yields the intended results. Question number 2, there was a situation where a young lady had an issue on the job and reached out, which was considered a legal situation. Are these situations that a legal help desk qualifies? How does that work? It was scheduled to be open last month, but it was said that we are waiting on the legal minds. Have the MP indicated that he had not seen it promoted and suggests that it be placed on the government website. Can I get some clarity? There were some other members who also asked about the legal help desk, and I tried to put most of the answer here in this answer. Regarding the specific case mentioned, a young lady experiencing legal issues at work, this type of matter is an example of what the legal help desk can potentially facilitate. However, as this is a labor-related issue, the correct course of action would be to first file a formal complaint with the Labor Affairs Office, and then the office will then attempt to mediate the issue. If this mediation process is unsuccessful and the matter needs to be taken to court, a yellow card can be issued, allowing the individual to be assigned a lawyer from the list of participating legal professionals free of charge. The legal advisors at the help desk will be able to guide individuals accordingly. The suggestions to promote the legal help desk on the government website was already in the planning, and once the legal agreements with the participating lawyers and our legal minds are finalized, a new launch date will be set. We will ensure that all relevant information is made available on the government website and through other communication channels. MP Gumbs, aside from trying to iron out the financial issues, is there going to be some other type of action taken for accountability? Can there be some clarity? This matter is in the hands of SZV, who is the entity responsible for the management of the social healthcare funds. A control unit is currently being established that will be charged with the responsibility of controlling execution of the care products procured. This will entail both a medical as well as a financial control. MP York, communication. MP York, SZV, there's an enormous medical cost, referral patients sent abroad. What are the checks and balances moving forward that the government plans to initiate concerning the handling of patients abroad? Following my recent work visit to Colombia, meetings were had with a referral team of SZV to ensure that the communication between SZV and the patients and between SZV and the Colombian physicians is adequate. Some of the bottlenecks identified in Colombia through discussions with over 50 patients and their companions, we discussed solutions and try to find ways of making improvements. It is the ministry's intention to put a structural solution in place that could involve a special envoy or liaison office to ensure that the referral costs are reduced while still providing adequate health care for our people. And as also indicated to MP Gumbs, so there's a control unit that's currently being established, and that will be charged with the responsibility of controlling execution and care products. Next question for MP York was, there is a third party that is the link between the hospitals where the patients are referred to off island and the SZV without anyone being able to verify. Some patients that are sent end up doing surgery in areas other than where they are sent for, and the cost keeps going higher and higher. Does the government have any plans to implement anything to mitigate these things from happening, which will also raise the quality of the service? Basically, the patient's experience. I am thinking here that if this was MP York's or MP Duran's question, I think it was MP Duran's question. It was MP York's question. Okay, good. MP York, to you, via the chair. Besides the research that was done of the pertinent issues experienced by the patients in Colombia, the ministry is looking into the possibility of designating a small team, as mentioned before, to communicate directly with the international office and to assist patients better and facilitate the process for them, with the end goal of shortening the process while maintaining the level of healthcare needed. A third-party service in the region, such as Comeva, has been terminated for quite some time and has been replaced by the international desk of each individual hospital. Are there any plans concerning the function book of the ministry? What are the plans when it comes to updating the function book? The ministry is actively working with P&O and their relevant consultant to draft the revision of the function book of the ministry. Currently, the final review per department's units are being finalized to be signed off by the SGVSA as the first step in the legal advisory process. So yes, we are busy working on the function book. Moving over to questions by MP Utley. Regarding the hub, we need to find out what is going wrong financially, and 2, how can we remedy the situation, and 3, the real persons that sought attention. The evaluation that was done on the HAP determined that there is a necessity for a HAP. However, the HAP has to be executed in the manner it was intended to be done. To elaborate further, at the termination of the pilot project, it was determined that the HAP was charged with services and frequent visits of the same patients, which was not in line with the agreement. The findings also indicated that instead of referring the patients to their GP for follow-up treatment, this did not take place. Other medical services, which were not included in the agreement, were also carried out and billed to SZV. The HAP was used as a means to receive late-hour GP services, and this service is already included in the existing subscription fee applied by ZV funds for all GPs. In the assessment that was done, the assessment yielded a total of 3,294 clients, of which 48% required GP service, 30% were direct patients of St. Maarten Diagnostic Center. A total amount of 11,598 services were declared to SZV. So to answer your question, HAP submitted declarations for a total of 3,294 unique patients, for whom a total of 11,598 services were declared. Based on a random sample, SZV came to the realization that not all services declared by the HAP were rendered. Regarding the night hours, the question was, MP stated, I am glad that it is being taken up, but is it a priority of the minister? Yes, it is. That's why we had the meeting with the head of the ambulance department. Question number 3, can I have an update on the breakfast program? Is it budgeted for? It was budgeted in 2024. The intention was to start with 3 schools, then do the rest. Why hasn't it started? Is it the intention to continue? If so, why? If not, why not? The NutriKids Healthy Breakfast Program was approved for a 3-month pilot project under the directive of the then Minister of VSA and was executed by CPS in collaboration with a local restaurant from November 2023 through February 2024. An evaluation report was drafted by CPS, and the findings and recommendations included setting clear objectives and direction for the program and the need for the program to be financially sustainable. The report also highlighted the need for collaboration between primarily the ministries of VSA and ECYS. It is necessary to establish an integrated strategic plan where each ministry lists their respective objectives and responsibilities to contribute to the successful, sustainable execution of the project. Question number 4, I would like to know the update on the health information system. This was also on the priority list. The health information system project, currently being implemented under the supervision of SZV, will be able to generate the necessary data output once completed if all goes according to plan. This project will be finalized by the 2nd quarter of 2025. Question number 5, I would like an update on the St. Maarten General Hospital, SMGH. Is there any additional cost? Are there any additional costs? I know that there was inflation, but can you inform the members of Parliament the cost at the start of the project and the cost now? According to information received from SMMC, the status regarding the construction is as follows. The design of the building was adjusted in July 2024 to meet the 4th revision of the design and build contract. The main building consists of basement, including water tanks and the seismic isolators for earthquake protection, is completed. Ground floor is approximately 50% ready to be completed by the end of October 2024. The main building is expected to be ready by the end of the 1st quarter 2026. Hereafter, the hospital will move from the old to the new hospital, after which the old hospital will be demolished and the lobby of the new building will be constructed. This should be ready by the end of 2026. Retaining walls were completed except for one last section of approximately 50 meters between Technical Building 1 and 2. The structural works on Technical Building 1, the structural works are ready. The structural works on the wastewater treatment plant is completed. Installing of the equipment has started, and the wastewater treatment plant will be operational by the end of the year. Procurement of the large medical equipment is ongoing. Regarding are there any additional costs? There were no significant additional costs since the previous amended contract of July 2020.